Welcome again. Our program today will last for 90 minutes until 4:30 Central European Time, and it includes 3 items: the introduction, which is what we're doing now, and then a presentation of the 4 research agendas on care, work and pay, access to health, and gender-based violence. And then we will end with a moderated Q&A session, which will last for approximately 30 minutes. So please write down all your questions or comments and things you want to discuss during the presentation of the agendas, and we'll return to those at the very end of our session around 4 o'clock. Now, RESISTIRÉ, the research project that is presenting or hosting this webinar, analyzes the impact of COVID-19 policy and its policy responses on gender inequalities throughout Europe. Every 6 months until March 2023, we publish up-to-date research reports, policy recommendations, and we launch, after open calls, a series of innovative pilot actions to foster a fairer social recovery. More importantly for today, and the things we are going to discuss now, is that based on an extensive data collection and research insights, co-creation and solution cycles, RESISTIRÉ identifies knowledge gaps and related research needs. It means that we are currently at the dark green box towards the right side of this beautiful figure. The dark green box at the top right corner, that's where we are today in our research project. You can read more about RESISTIRÉ and our research project on our webpage, resistiré-project.eu. So why a research agenda, and what is a research agenda? So as researchers, we are convinced that doing research does not only involve analyzing problems and finding solutions, but it also involves identifying the unanswered questions and the new research problems, the unforeseen, the things that we didn't have the capacity to do research on ourselves, but that we can see that we need to know more about. So research should identify knowledge gaps and limitation and strive to collaborate with and communicate these results to the research funding community. So while we're conscious that RESISTIRÉ obviously cannot answer all the research questions or identify all the research needs linked to the impact of COVID-19 and its policy and societal responses, we nonetheless have identified knowledge gaps and future research needs in 4 of the domains of the European Commission's Gender Equality Strategy 2020 to 2025. The 4 domains we've identified these gaps in, are care, access to health, work and pay, and gender-based violence. These, there we go. The care research agenda will be presented by the RESISTIRÉ team member Roberto Cibin. He's a researcher at the Institute of Sociology at the Czech Academy of Sciences. The agenda on access to health will be presented by Federica Rossetti, who is a scientific researcher at Scienzano in Belgium. The research agenda on work and pay will be presented by Anne-Laure Humbert, Professor of Gender and Diversity at Oxford Brookes University in the UK. And the research agenda on gender-based violence will be presented by Ayşegül Altinay, Professor at Sabancı University in Turkey. And as mentioned, our Q&A session, which starts at 4 o'clock, will be moderated by Alain Denis, who is Managing Director at Yellow Window in Belgium. So without any further ado, I leave the word to Roberto Cibin to present the care research agenda.
Thank you, Sophia. And so just the classic time to share the screen. Okay, I hope everyone can see it. It's my responsibility to introduce the part of the research agenda that has to do with the domain of care. So with care work, we mean the activity of providing personal services to meet the physical, psychological, and emotional needs of one or more other persons. We can split this domain in 2 main areas. So the care work that is visible, so that is institutionalized as paid employment, and the one that is invisible, so that it's made at home mainly, and it is unpaid. We noticed it is well known that this area has an visible increase during the pandemic, and this area is also the main focus of the RESISTIRÉ mapping activities. So the research agenda is related to care, has been divided in different areas, let's say, that has to do with women's care responsibility and women's work, men's care responsibility and care work, the retraditionalization of care responsibilities, changing care patterns related to who is dependent on care, the lack of an equality perspective in pandemic policy making and effects on inequalities, and the impact of societal initiatives during the pandemic. So let's try to see them more in focus. The first one, knowledge gap that we found is related to the effect of the pandemic on women's care responsibilities. During our phases of research, we noticed that working hours had decreased substantially for working women living with children under 18, compared to men living with children of the same age and working women without dependent children. And probably this was related to an increased uptake of part-time work. We found that women took on the majority of care responsibilities and were particularly burdened with homeschooling. I kindly ask to turn off the mic, please. Thank you. Care responsibilities increased during the pandemic due to the loss of formal and informal support. There are initial evidences of consequences of the situation for women's well-being. So women have more problems than men on mental health. They've been more overwhelmed, stressed, less satisfied with work and family life in general. And then there is a lack of comparable data at the European level on time spent on housework and childcare pre and post-pandemic. For these reasons, we invite for more investigation on how have the increase in care responsibilities during the pandemic affected women's work patterns, and what long-term consequences may this have for women's possibilities to secure working conditions, careers development, and economic security from a life cycle perspective. And then the second question that we pose is, how have the increased care responsibilities during the pandemic affected women's well-being and mental health? Then passing to the second knowledge gap area that we found, this one is related to men. So we found that we just saw women took on the majority of care responsibilities and were particularly burdened with homeschooling. But at the same time, there is evidence that some fathers increased their contribution to childcare during the pandemic. This is due to the increase of remote working among men, which led to greater flexibility in work hours and reduced commute times. This phenomenon can have potential effects on the evolution of men's care responsibility and the masculinization of care work. So because of this, we invite for more investigation on what short-term and long-term effects has increased remote working among fathers had on gender norms and the gender division of care labor. Then we ask, what are the effects? What effects have the increased care responsibilities of men had on their work and health? And finally, what effects have the increased care responsibilities of men had on their family relations? Then moving to the third area. This one is related to the retraditionalization of care responsibilities, intersectional perspectives, and the effects for unequal division of care work. So we found that despite the increase in male participation that we have just seen, the findings indicate a retraditionalization of gender roles associated with care responsibilities. One example is how during the pandemic, young women and girls living at home have increased their participation in care work. Then there are also initial evidences that show how the level of burden and the division of care responsibilities are influenced by intersectional gendered causes. On one side, we underline how single parents families, families with several children, families with low incomes, and families where parents had lower levels of education had more struggles with childcare and homeschooling. On the other side, less educated women were disproportionately hit by the unequal division of household chores and faced mutually reinforcing barriers as low labor force participation, limited social protection coverage, and more stringent traditional gender norms. And finally, the findings indicate that a lack of data to conduct analysis of the intersection between the gender care gap and inequalities relating to race, ethnicity, nationality, sexuality, and gender identity. Therefore, there is an overall research gap related to the short and long-term effects of intersectional gender norms and behavior associated with care responsibilities. And so the questions that we propose related to these findings are, what long-term effects will the widening care gap during the pandemic have for the division of unpaid care work post-pandemic from a gender perspective? And then, how have the increasing care responsibilities during the pandemic affected women and men from an intersectional perspective, such as for young single mothers and fathers, elderly women and men caring for younger and older dependent others, people in different geographical locations and from different socioeconomic backgrounds? The four areas of knowledge gaps that we identified has to do with the changing care patterns during the pandemic on those who are dependent on care. So we found that people who are particularly dependent on the care from others, such as people with disabilities or very young or very old people, have been severely impacted during the pandemic and have often experienced precarity. For this reason, we ask, how have patterns in the provision and care needs changed during the pandemic, and to what effects for those groups that are dependent on informal unpaid care? Then another area that we propose is the lack of an inequality perspective in pandemic policy making and the effects on inequalities. In this area, we found that we underlined a scarcity of policies aimed at mitigating the problems that emerge in the management of care activities. Consequently, also in this occasion, the underlying causes of the gender care gap in general have not been addressed. Then we saw that while most policies introduced to support care activities helped a portion of women to maintain an income and not lose their jobs, they also contributed to reinforcing gender stereotypes that see women as the primary or sole caregivers. In addition, policies almost completely lacked of sensitivity in relation to issues concerning gender and its interaction with other inequality grounds. For instance, measures are usually heteronormative and usually refer to fathers and mothers. And then often measures do not take into consideration all the informal relations that exist. For instance, those that are not defined by contracts, citizenships, or family relations. And then we found that there are variations in the findings, but some results indicate that the gender composition in policymaking and the non-involvement of experts and the lack of consultation with civil society can have an important influence on the quality of the results of the policymaking process. So in this case, we have some questions that we propose. For instance, how the composition and political areas of decision-making bodies had an influence on the type of policies designed to support care activities, both on the level of gender sensitivity of these policies and on the ability to take into account different categories of people, for instance, not regular workers, self-employed, single parents. And then another question, how has civil society been engaged in the policy making? Has the absence of consultation with civil society had an impact on the type of policies designed to support care activities? Then, how have pre-pandemic policy mechanisms to ensure the integration of a gender perspective into policy making been affected by the pandemic, and to what effects? And finally, what have been the best practices in place during the pandemic to support carers combining paid and unpaid work? Who have been the actors and what have been the effects? And then the last area that we underlined has to do with the impact of societal initiatives during the pandemic on inequalities related to care responsibilities. So in this area, through our analysis, we have been able to identify different kinds of initiatives promoted by the civil society on issues related to the domain of care. Just some examples of the categories of these initiatives are initiatives to support care activities for children and persons with disabilities, campaigns and lobbying activities on gender equality and gender care gap, emotional and psychological support, activities to support children's education, and knowledge dissemination. However, there remains a research gap on the effects of civil society during crises such as COVID-19. For this reason, we suggest to promote the use of action-oriented and participatory research approaches to support knowledge development around how and when gender norms and practices can be transformed. These approaches represent also important tools to build the pillars of evidence-based innovations within the domain. Therefore, we also suggest to increase the focus on the exploration and development of innovations aiming to mitigate gender plus inequalities caused by the policy responses to COVID-19. For this, the perspectives of underrepresented groups of women, as well as men and children, need to be considered. So to conclude, there is a need to focus the investigation both on short and long-term effects. There is a need of an intersectional approach to understand the complexity of the situation. The focus has to be also on men and masculinization of care. It's important to study the correlation among sensitive equal measures and the composition of the decision makers and the involvement of vulnerable groups. And it's important to focus on the involvement of CSOs and underrepresented groups of women, migrants, refugees, people from LGBTQE+ communities in the research process. Thank you very much, and I hope this helps.
Thank you, Roberto. We will again ask you to save any questions or comments to later on, and instead move on to the next research agenda, which is access to health, which will be presented by Federica Rossetti from Cienzano in Belgium.
Thank you, Sophia. Thank you, everyone, and good afternoon. Thank you for joining the webinar, and I'm going to share my screen. So I hope you're seeing the right presentation, and I hope you can hear me properly. So thank you. And as Sophia said, I'm indeed Federica Rossetti, scientific researcher at Cienzano. And today I'm going to present you the research agenda for access to health. So before starting, I would like to say that access to health was the focus of the human rights domain in the first cycle of the project. And by access to health, we mean rights to have the resources needed to preserve or improve individuals' health. And during the pandemic, the right to healthcare was particularly put under stress. And as we will see in a minute, the inequalities that were prior to the crisis present in this area were reinforced during the pandemic. This is an overview of the knowledge gaps we are going to see today, starting from the first one, which is gender plus inequalities in health and healthcare. So this area, beside mortality, we have seen that during the pandemic, there was an increase in many other health issues, and particularly problematic was mental health issues, such as depression or anxiety. And in particular, we have seen that in some countries, the impact on mental health was stronger for women. And we also found that that difference were intersected with other vulnerabilities, such as an employment status or parental status. Addressing these situations requires, among other factors, adequate access to mental health care and mental health support. Yet, even before the pandemic, we see that in Europe, there is a high level of unmet need for mental health support. So this will inevitably increase and worsen during the pandemic and after the pandemic. So the situation may deteriorate if we don't take any action. Also, in addition to this problem, during the pandemic, we see a postponement. We have seen a postponement of those healthcare treatment that were considered non-urgent, and also an unequal rise in of unmet healthcare needs more generally. So this was particularly felt by some vulnerable groups, such as women or transgender people, but also people with chronic illnesses, which have their specific healthcare needs. So for this area, some of the research questions that we would like to see addressed are starts from the idea that we would like to see the development of concept of healthcare based on an holistic interpretation of healthcare, which means that we are not interested only in the physical needs of the patients, but also social and mental health needs. We also would like to understand the areas of healthcare in which women and other vulnerable groups, such as LGBTIQ people, have been disproportionately affected in a negative way. But we also would like to understand how non-urgent procedures were defined and what the implications are for those vulnerable groups. The second area is very related to the first one, and because we would like to go more in deep, we would like to deepen the link between access to care and other domains and vulnerabilities that were studied in the project. So for instance, here you see in the slides 3 examples in which we saw that vulnerable groups were more affected. And so for instance, the increase in care responsibilities, as Roberto pointed out before, it made more difficult, especially for women, to allocate time and resources to their healthcare needs. But also economic challenges and unemployment, for instance, might have reduced the frequency of doctor visits. And also we have seen the connection with gender-based violence, which was another domain of the project. And specifically, we saw that victims of this type of violence could rely less on what was before the pandemic, their first point of access to support, which means doctors and nurses or other social workers. And so in this area, what we suggest is that we need to identify the different societal groups with their specific problems and issues, and focusing on the concept of community health, which means that this community have specific healthcare needs that need to be addressed. But also we would like to understand in which ways new methodologies and participatory tools might reach these vulnerable groups in society in order to help policymakers to develop inclusive health policies. The third knowledge gap we identified in the area of access to health relates to vaccination and vaccine hesitancy. So despite the fact that COVID-19 vaccines are now in most of the European countries available for free, we still observe inequalities in vaccination rates, which means that some specific group societal groups have low vaccination rates, such as people with lower socioeconomic status or ethnic minorities. And also our analysis, especially from the RAS, indicated that women were more hesitant to get vaccinated against COVID-19, while whereas high level of education and age were a factor that increase the willingness to get vaccinated. And so in this area, some of the research questions we elaborated relate to the assessment of these vaccination inequalities and how we need to understand the reasons behind the inequalities in vaccination rates. But also we would like to understand what the promising practices and methods are to increase the vaccination rates and how vaccination rates among the whole population, so to apply them on a large scale. The fourth knowledge gap in access to health refers to a specific group that has suffered one of the heaviest burdens of the pandemic, which is the healthcare workers. So within this group, we also observed a gender divide, which means that women are likely to have the higher risk position within this group. But also we have observed that there are other groups that have a higher risk. For instance, here we see the undocumented migrants because they might have fear of deportation to get to access healthcare, or they might simply not have access to, they might not have the right to access healthcare. And another big problem in this area is the understaffing in the sector of healthcare, which means that there is no time and possibility to provide quality care to the patients. And so what we have seen is that healthcare workers have learned a lot during the crisis. And so in relation to this specific group that was hit during the pandemic, we would like to understand the consequences in the short and in the long term of the gendered composition of healthcare jobs. But also we would like to understand how we can prevent the staff from becoming overworked and to make the profession more attractive in order to have more people working in this sector. So we also would like to understand and to make the first-hand experiences of healthcare workers, to take them into account in decision-making processes related to COVID-19 decision policy that have been implemented during the pandemic. The fifth and last knowledge gap I'm going to show today relates to the increased digitalization in healthcare. So the digitalization has created and reinforced barriers for some population groups with no or limited digital means and literacy, such as, again, people with lower socioeconomic status, but also the elderly or people with disabilities. And these groups might have difficulties to access, to understand, or to use healthcare information because they don't have means, which basically means a laptop or internet access, but also they might not have the skills such as language skills to access this information. And so in this area, we would like to understand again the consequences of this digitalization in healthcare on the health of these vulnerable groups. But also how we can prevent or even reduce the digital divide in healthcare. So to conclude, what we have seen is that the crisis has a dramatic impact on population health, not only in terms of mortality, but also in other areas of health, such as mental health or the postponement of indeed what was defined as non-urgent. And also the crisis has a dramatic impact on healthcare providers, so very specific groups that really suffered during the crisis. And we would like to suggest that future research should examine the specific needs of the vulnerable groups and the context in which they are, with this intersectional perspective. So which means that we are interested in analyzing multiple vulnerabilities within the groups and within the population. Thank you very much. And I hope to have raised you some curiosity and need for future research. Thank you.
Thank you, Federica. Perfect. We're moving swiftly on. Please keep your comments and questions to Anne-Laure Humbert from Oxford Brookes University, who's Professor of Gender and Diversity. Welcome, Anne.
Okay, thank you, Sophia. Working?
Yep.
Yeah, perfect. Thank you. So I'm going to be talking today about the research agenda in relation to work and pay. So, of course, within the RESISTIRÉ project, when we're looking at the work and pay domain, we're looking at the labor market issues that are involved in that. We pay particular attention to labor market inequalities, such as the gender pay gap and the labor market gap, but also focus on the gendered experiences of work. And we understand work as being either formal and informal. So, of course, the gendered aspect of work and pay is nothing new, and we have seen many inequalities over many, many decades. But the context of the pandemic is actually changing things drastically, and we are experiencing not only another way of working, but also just very, very different impacts among different groups from a gender plus perspective. In particular, the research gaps that we've identified in the project, and I will unpack this in a little bit later, are related to the following areas.
So the gendered,
yeah.
We're losing the sound every now and then. So would you want to try to turn the camera off and see if that makes it better? Sometimes it wobbles as if you're in a swimming pool.
It's better.
Let's try. Thank you. Sorry for interrupting.
It's better. And then I don't have the camera on, so I can come very, very close to the microphone. Okay, so what I'm saying is some of the aspects of the pandemic that are really relevant for us to understand in the context of gender and the pandemic are the impact that are associated with teleworking, the impact that the pandemic may have on the gender pay gap, and particularly on the pension gap, which typically is wider, looking at the impact of policies in the domain of work, and the overlooking of gender differences and the impact that they have on different groups. Also focusing on the fact that there are vulnerabilities of women in the labor market, and this is just something that is well known, but there are really, really strong sectoral differences. And then finally, looking at the increased visibility of unpaid care work and its opportunities. So in the first research gap here, the gendered impact of teleworking, some of the questions that we're raising here are, for example, what consequences of teleworking on women's productivity, the household divisions of labor, and mental health. We also want to know whether women are going to take up teleworking more than men in the future, so how that's going to evolve. And how does the normalization of telework is going to impact inequalities, so there's the gender care gap and the promotion penalty in the long term. We also want to know about how can telework contribute to more egalitarian relations and distribution of care in the household. In relation to the impact of the pandemic on the gender pay and pension gap, I mean, here a very, very obvious question is to examine the long-term effect of the pandemic on the gender pay gap, which has had a tendency to reduce in recent years, but is now stalling, and what it's going to have in the long term on pension gaps. And in particular, how different groups and vulnerable groups in particular are going to be impacted by these developments. When it comes to policies in the domain of work and the fact that gender differences and impacts tend to be overlooked, we propose to look at research questions on how the pandemic has affected those that are working in non-formal or atypical forms of employment. We also want to know how different inequality grounds might lead to different experiences and outcomes for those in non-formal or atypical employment arrangements. We've noted the vulnerability of women in the labor market, and we've talked about sectoral differences. So here of relevance are how the pandemic has affected women's working patterns within different economic sectors, and what has been the impact of women's family arrangements on these patterns of working. The increased visibility of unpaid care work has been noted, and there are opportunities arising from this, but there are questions that remain on the extent to which the pandemic can lead to a re-evaluation of care work, and how policies and societal initiatives could reinforce and strengthen positive changes in making just the care work valued more strongly in society. So in conclusion, we feel that there are research gaps that need to address the need to consider the potential effects of recovery plans and policy on different groups in relation to work and pay, to consider the roles that are played by trade unions and employers' organizations in the design of recovery plans and policies, to increase the insight on the trends as long-term perspective emerge increasingly, including from a gender plus perspective. That this is going to be soon possible as we get more data. And finally, to illustrate and analyze the impacts on individual lives more generally. So not only having a more quantitative long-term assessment of the impact of the pandemic, but also to combine this and illustrate it from more qualitative evidence. Thank you.
Thank you, Jan. Okay, so again, please keep your comments and questions and write them all down, and we will move on to our final research agenda, which is on gender-based violence, and it will be presented by Ayşegül Altinay, who is a professor at Sabancı University in Istanbul.
Great, thank you, Sophia. You can see my presentation, right?
Yes.
Perfect. So I use the short form GBV throughout the presentation for gender-based violence, for those of you who may not be familiar with this short form. So gender-based violence has been named, has been referred to as the shadow pandemic or the second crisis that is accompanying the pandemic crisis. It's shadow because it's not as visible. We hear daily reports of who has been affected by the pandemic, but not by gender-based violence, which seems to have increased during the pandemic. And that's something that we have looked into and have suggestions for further research. LGBTIQ youth and adults have faced widespread gender-based and phobic violence at home and outside, especially during the pandemic. And so the different measures that have been used to make people safe during the pandemic, like stay at home, online schooling, lockdowns, have actually exacerbated the existing forms of gender-based violence and have added new forms to it. And that's something that we have been looking at as part of our research. So these are some of the points that we have identified as knowledge gaps. For purposes of time, I will move quickly into each one. Oops. Yes. So the first question we feel the need to ask is, has the pandemic intensified the problem of gender-based violence? The reports that we get from inequality experts, NGOs on the ground, and so on say yes, absolutely. Whereas the official data in a lot of countries reports no change. So there is a big discrepancy between the different kinds of data, which we suggest is something that needs to be looked at. And there is a major lack of harmonized, comprehensive, comparative data of gender-based violence in different contexts. So more research is needed into the discrepancies between the official data and reports coming from the frontliners, whether it's researchers, inequality experts, or NGOs. And we also need to ask the causes, look into the causes for these discrepancies. So what exactly is the change in the prevalence of gender-based violence during the crisis, and what have been the consequences of this for health and well-being in the pandemic and beyond? And a more general question related to this is, how is gender-based violence defined? Who or what is excluded from this definition, or the operationalization, its operationalization in different policies in different countries? Is digital online violence taken into consideration, for instance, or psychological and economic violence? How about the violence experienced by the LGBTIQ population, and so on? The pandemic has introduced new contexts, especially changing the conditions of work and education, as well as introducing new forms of violence. That is our preliminary finding in the first cycle of RESISTIRÉ. So we have a set of research questions that have to do with the context. How have measures such as isolation, lockdown, and digitalization changed the experience of violence? Has it introduced new forms of violence? What have been the effects of online work in education for gender-based violence? For whom has the home been a safe place during the pandemic? So a set of questions need to be asked about the context of the home. For whom is it safe, and how can it be made safer for different populations? Are there patterns of difference between different countries, especially looking at the different policies they've used in the context of the pandemic, lockdown, isolation, and so on? And the research, as well as the reports coming from NGOs, alert us to the urgent need to look into a new form of violence, or a form of violence that is becoming more visible and more widespread, online digital violence, with the increasing digitalization of our lives, and the need to integrate this form of violence into our analysis and into policy making. So a lot of research needs to be designed around online digital violence to see how it's changing lives. The changing patterns of reporting and support is also a knowledge gap that we have identified. During the pandemic, women and LGBTIQ who have experienced gender-based violence seem to have relied more on online services as opposed to the conventional audio hotlines. And they have sought support more from healthcare providers, NGOs, and local pharmacies rather than the police. This has, of course, put more pressure upon shelters and NGOs. And of course, with digitalization, the question of digital literacy and lack of access to digital tools has been put on the agenda. So the main research questions that we pose in relation to the changing patterns of reporting and support is, has there indeed been a decrease in reporting, as well as the handling of cases and sentencing, as we see in different contexts? How is it in different countries, and how can we analyze this? And how can the reporting of violence and abuse be facilitated and effective response policies developed? How can women and vulnerable groups access digital help seeking and support tools? What are the opportunities and constraints? Do we actually need new tools, or is it just a question of digital literacy and digital access? How have digitalization and digital illiteracy affected reporting and response? What new forms of reporting and response need to be developed, both by public authorities and NGOs in cases such as lockdowns? What have been some of the better stories of preventing and responding to gender-based violence during the pandemic? And which systems have responded well to the new challenges posed by the pandemic? What made these systems more sustainable, more resilient in the face of a new crisis? And what can we learn from the systems that were more resilient as we look into the future? The question of vulnerability and intersectionality, as my colleagues have pointed out, has been important in all of our domains. So here we suggest that in addition to looking into how gender-based violence is experienced intersectionally, we also need to do a comparative policy analysis to see who is included or excluded from policymaking on gender-based violence. To what extent have organizations working with victims and survivors been consulted in the context of policymaking and supported by the existing policies? And what would we see if we did a comparative analysis of policymaking in this time of crisis? What are the effects of policy and policymaking processes on prevalence of gender-based violence for different groups? So an intersectional analysis of how policies have affected the lives of vulnerable groups. And our preliminary findings suggest that the most vulnerable have been made more vulnerable in the face of gender-based violence during the crisis. Women and LGBTIQ living with perpetrators, women in trafficking and prostitution, undocumented migrant women, and marginalized minorities such as the Roma have been disproportionately affected. I also want to mention the 2 policy recommendations out of the 8 that have come out of the first cycle of RESISTIRÉ, which have focused on gender-based violence. One of the policy recommendations has aimed policymakers at the EU level. The main finding from our qualitative research is that the failure to finalize the adoption of the Istanbul Convention at the EU level has been a contributing factor to increasing the conditions for and occurrences of gender-based violence during the pandemic. But more research needs to be done to see how this has actually happened. So we need comparative analysis of countries that have adopted and put into implementation the Istanbul Convention and those that have not. The main recommendations that we have highlighted in this policy recommendation is strengthening the EU legal framework and finalizing the EU accession process to the Istanbul Convention. Collecting data and good practices. There seems to be a lot of need for more data, both on the prevalence of gender-based violence and on the response to gender-based violence in different contexts. Fostering prevention programs and awareness campaigns, and more recently in our workshops, there has been a lot of emphasis on prevention programs that target the perpetrators. So more perpetrator-focused prevention programs and awareness campaigns are needed. And all of this, of course, needs to be done from an intersectional perspective, and policies need to be adapted to the different needs of different vulnerable groups. The other recommendation sheet that has come out of the first cycle has focused, targeted national policymakers. Developing multi-sectoral collaboration and intersectional coalitions has been highlighted in these policy recommendations, promoting the collaboration by national and local authorities with feminist, LGBTIQ and other vulnerable groups that are organized around their needs, and for these groups being involved in the designing of solutions. And our qualitative research has shown that indeed there has been very creative networking and design of solutions coming from these organizations at the grassroots level. So bringing them together, there's a lot to be learned from their experiences and wisdom, it seems. Ending the data gap to make informed decisions has been highlighted in this recommendation. So again, highlighting the need for more research on gender-based violence, strengthening support services in times of emergency, ensuring resilience, and making sure that shelters and counseling for gender-based violence keep running so that they're regarded as essential services during a crisis such as the pandemic. So need for crisis policies and need for identifying response to gender-based violence as an essential service has been highlighted. Promotion of the use of digital technologies, and carrying out safety improvements in public spaces with a gender plus perspective. And of course, a new public space has become the internet. And lastly, we wanted to highlight the need for more research on gender-based violence experienced by LGBTIQ communities. And here you can see some of the findings of ILGA, the International Lesbian, Gay, Bisexual, Trans and Intersex Association, that also shows that there has been an increase in domestic violence experienced by LGBTIQ populations, and that there is a lack of LGBTI specific measures in the existing policies and support mechanisms. There have been transition related healthcare issues or gender compliance procedures. In the context of the pandemic, they have been strictly limited. And of course, something that my colleagues have also mentioned, the heteronormative family model can be quite detrimental and sometimes lethal to the lives of LGBTI communities. And LGBTI refugees and migrants constitute another major vulnerable group, especially in the course of the pandemic. So one thing that we have highlighted as RESISTIRÉ is really the need for an expansion, a more comprehensive understanding of gender-based violence that includes and looks further into the experience of LGBTIQ plus communities across Europe. And I will stop here.
Thank you, Ayşegül, and thank you, Roberto and Federica and Anne, for all of your presentations. It's a bit daunting with all these knowledge gaps and data gaps, I find sometimes. But we will move swiftly on to a Q&A session that we have moderated by Alain Denis from Yellow Window. Alain, I will give the microphone to you.
Thank you all for the presentations, and to pass on for an easy task at the moment, because there are no questions yet raised in the chat, and that's the channel we propose to use. So Sophia asked you to write down your questions during the presentations. I hope you did so. And so please, if one of you has a question, you can raise your hand at a moment to launch a question. Otherwise, please put them in the chat. Still no question. Then maybe, yes, I raised hand, but I don't see the name. So Christina, please.
Hello. So it is very nice to be in this presentation. First of all, I'm really glad that you investigate gender inequalities so thoroughly, and I will look more into the work of RESISTIRÉ. It's a very specific question to Ayşegül. About mental health repercussions of domestic violence during the pandemic, and you said that this needs to be investigated, but shouldn't this be always investigated in comparison to previous and well-known repercussions in mental health that domestic violence or gender-based violence in general had, because I'm investigating this.
I think that's a really good question, and that's a relevant question for all of our domains. In some of these domains, there is enough research where we can do comparison. How was it before the pandemic and how is it taking shape now during the pandemic? And in some areas, there's simply not enough research done that is existent. So for each research question, I think we need to deal with this question of temporality and this question of comparison differently. But in any case, I think in the case of gender-based violence, for instance, it's such a prevalent issue right now. Looking into the, for instance, mental health implications of violence during the pandemic would in itself be significant in terms of creating new forms of response, creating new policies, and creating inclusive, healthy environments of work and education and of life in the years to come. So even if we cannot say how it has changed with the pandemic, in some cases we can and in some cases we cannot. But even if we cannot do that, I think it will be significant enough to to understand the present moment and to look into the future.
Thank you very much. That was a very comprehensive answer, and we're all working towards that. I will try and follow Resistiré more and probably communicate with you. And something else, you said that more LGBTQI people have been victimized during the pandemic, and this is something I found too in a project I did last year, and I'm trying to publish it now. It was only marginal in my findings, in my sample at least. But have you noticed any other demographic differences or any other sort of differences in the people who were first victimized during the pandemic? And do you think that it is relevant to investigate that, differences of people who first had such experiences during the pandemic?
I think that would be a great research question. Certainly people who have for the first time during the pandemics experienced any form of gender-based violence. I don't know any research that specifically focuses on that question. So we can certainly add your question as a relevant research question to these set of questions. Certainly right now, all of the organizations that work on gender-based violence, whether they're supporting victims or they're designing programs for perpetrators, are suggesting that this is a new context and we need to understand, I mean, in the case of gender-based violence, yes, there are structural problems that we need to take into account. It has always been a crisis, but the pandemic constitutes a new context that we also need to take into consideration. So how has this new context, for instance, having to live with a perpetrator, not even having the space to make a phone call to get support, not having the chance to walk to a shelter or to a women's organization or an LGBTI organization to get support. And in the case of, for instance, LGBTIQ youth, or in the case of young women, having to go back to live with their families during the pandemic has created a new form of vulnerability, and there has been significant increase in their experiences of violence. So all of these different changes in the context need to be analyzed. And so there's a lot that we can and should do. And I think your research question is great. And if you publish on the experience of LGBTIQ experience of violence, please do let us know so we can refer to your research as well.
Thank you very much. That was again a very helpful and fruitful answer. My research is not focused on LGBTQI, it's just mentioned as another demographic group. But yes, thanks again, and we will be in contact certainly in the future.
Thank you very much. We do have another question, this time for Anne, and I think you saw it in the chat, Anne. So when you mentioned intersectionality in the frame of work gap and pension gap, what kind of intersectional situations do you have in mind?
Okay. Is my sound okay? Yeah, okay.
Yes.
Just let me know if it's so. It's a very, very interesting question. I think in responding to this, we have to be clear about what's happened to the pension gap over the past decade. So it has reduced, and this, I'm quoting the figures approximately, I don't have them exactly in mind, but from about 40% in 2012, and within the space of a decade, that has reduced to about 30%. That is still a huge, huge number to have. So the problem of the gender pay gap, the gender pension gap, is that, of course, we can understand it as the sum of inequalities and discrimination over a life course. And this is just based on gender differences, but of course, those gender differences mask the extent to which other factors are going to produce different results on the labor market. What we know is, in the context of a pandemic, is that there are other intersectional factors that have reshaped the labor market, and some of them that I think are particularly relevant are to talk about ethnicity and to talk also about migration. In this, different sectors, different experiences of the labor market, different exposure to the virus and so on, are going to maybe have just a very, very different impact on the gender pension gap generally. I think there is also some scope to look at age, because the gender pension gap is very much dependent on the generational effect. It's just different cohorts in the labor market have had different opportunities to contribute or not to a pension scheme that may be private or public. They may also have experienced just different inequalities on the labor market itself. So we should just try and monitor for that a little bit, just like going forward. And of course, it just the big question here for me that remains is, we've seen a narrowing of the gender pension gap over the past decade, which is just something that's very welcome. What we have to wonder now is whether this is just going to continue to narrow, and particularly try and disaggregate this, just to have information about how different groups are going to be impacted by that. So I hope that answers the question somehow about what are probably some of the most salient and grounds of diversity to look at in terms of the gender pension gap.
Thank you. I hope this answers the question. We can still use additional questions, so do not hesitate to put on the chat. I received a direct, Emilie van den Broek continues on the discussion. Do you already have specific results per country so that we could see which recommendations would apply to the country where we work? That's again for you, Anne.
I don't think it's for me. I think it's a more general project related to project outputs. That's how I understand it. Do we have results per country, just more generally?
Yeah, my question was more general, sorry.
So then maybe Sophia.
Yes, we do have results per country. We've done a mapping of policies and civil societal responses in all 31 countries, which Roberto has been in charge of. So if you want to say something, then cut in and do. And then we did the rapid assessment survey mappings, which is also partly country-based, correct, Anne? So we have the research and the insights results based on country, but we haven't developed a recommendation specifically on a country level yet. So in terms of your question there, we're still in the first part of that little figure that I showed you.
Okay, thank you. But where are they available on the website? Because I tried to find something specific to my country, but I couldn't find it easily. But maybe I looked at the wrong place.
So Roberto, could you send the link to where the civil societal and policy responses are on the webpage and put it in the chat?
Thank you so much.
Thank you. We will look into that as well to increase the readability and the search potential on our website. For your information, Aisha already introduced, or one of the questions also was linked to the availability of the presentations. So everything that RESISTIRÉ produces is put on the website and on Zenodo, so it's open access, not only the research agendas, which we are presenting today, which are short documents, 5-6 pages, which have served as a basis to make the presentations today. But you have more information in these documents. The recommendation fact sheets that Aisha mentioned, 2 of which are linked to gender-based violence, but all the research results from the different activities that we develop inside RESISTIRÉ. And as Sophia said, and I assume you understand, our research project is quite original in the sense that we work in cycles. So we are a 2-year project, but we produce every 6 months results. We don't wait till the end of the project. We try to have outputs which are valuable and can be used by stakeholders. And why is that? It's because the urgency, of course, of the impact the pandemic and the policies that we develop to combat the pandemic have on vulnerable groups. So we try to make policymakers aware of these impacts so that it can take corrective measures at least. So that's maybe an element of context. So I had a question which was linked to the fact of considering women as a vulnerable group. So women as a group to be considered as a vulnerable group, which was mentioned in the presentation of Federica. And so the question is maybe more to Sophia, is that this is indeed how we have been working, so systematically considering the women as a vulnerable group in the project.
Yeah, that is correct, because we use gender as one of the main inequality grounds and a principle around which societal processes and power is structured, basically. So we see gender as a main inequality ground. Some would say that it can be seen as an organizing principle around which everything else is structured, but gender is always obviously intersected by other inequality grounds. So it's never pure, it's never clean. It always comes with class, with sexual orientation, with age, with ethnicity, and other different inequality grounds. But if you look at the presentations so far that we've heard from gender-based violence, work and pay, health and care, women are bearing the brunt of the costs of the pandemic in terms of being victim survivors, or the ones who lose out, or the ones who don't have access to healthcare in the same way as other groups. So in terms of these domains, and all the domains, I would say, of the EU Gender Equality Strategy, the European Commission Gender Equality Strategy, women is a vulnerable group. That's how we address it. I feel like I'm giving a little speech here, but that's how we conceptualize gender and vulnerability in terms of women as a vulnerable group, for sure.
So one of my I'm always stressed when I have to facilitate Q&As is that there are too many questions and I don't have time enough to read all of them. And to group them today is not a problem. So do not hesitate to, again, raise your hand or put a question in the chat. But a link to the discussion we had earlier on the safety of the home in the pandemic situation. Sophia, I think you have also results to share on that subject, which was already raised.
And there was something that was raised, I think, by Christina and then in Aisha Gu's response in their discussion about the lockdowns and the pandemic. And something that we want to look further into is this notion of the home as a safe space, which we're always working with gender-based violence and violence against women. You obviously know that home is the least safe space for a person to be. But the policy machinery and the policy recommendations during the pandemic has somehow conceptualized the home as a safe place. So we think that this is something that we need to look even further into, not just not just as research within the confined field of gender-based violence, but it needs to be mainstreamed into all other fields, that the notion of home as a safe place needs to be considered when we're talking about responses to outbreaks, and in particular lockdown policies. And I'm going to hand over the, what's the word when you do when you run and you give on the, you give the baton to the next person. Yeah, to actually good.
Yeah, thank you. I'm getting it. Taking your hand. And I think this is also maybe a good point, point to emphasize another significant aspect of the RESISTIRÉ research, which is learning from those on the ground, learning from grassroots organizations, NGOs, people who are engaged, who are part of these vulnerable groups and who are working with the vulnerable groups that we're talking about. And one emphasis that we have in the project is on the need to learn from the better stories of responding to these inequalities that have already been developed by NGOs, by vulnerable groups themselves. And as Sophia says, those groups have already been saying the home is not a safe space. And we should have learned, the policymakers should have learned from this wisdom already in designing the policies. And something else that comes across when you look at gender-based violence is that feminist organizations and LGBTI organizations have developed incredibly creative mechanisms to respond to the changing needs, to the changing context, and also to get into new networks to strengthen, to empower the response and to give as much support to vulnerable groups in different places. So as we move into an era where we need crisis policies, I mean, a lot of suffering comes out of the fact that there are no policies that were already available to respond to a crisis like this. As we develop new crisis policies, there's a lot we can learn from the existing knowledge and experience of these vulnerable communities, of these organizations. So certainly more research is needed, and that's something we're trying to do in RESISTIRÉ on the existing better stories of responding to inequalities. That's already there in the field. So making that visible, connecting those stories and learning from them to develop better policies.
Another question raised is, maybe Federica mentioned it, but do you have any results on the access to sexual and reproductive health during the pandemic?
Short answer is no, we don't have it, unfortunately. We haven't really specifically looked at the access to, how, I mean, in terms of data, basically because as it was already mentioned that there are like huge data gap on all these kind of topics. So it's very difficult to find data on that. And we hope to be able to maybe address this in the future cycles.
Thank you for the quick answer. We have a hand raised from Jeanne Lenders.
Yes, good afternoon, and thank you for the presentations. That's really interesting. When you mentioned the positive developments, I was wondering if you have some examples and also how you see that in terms of sustainability, or how those can be sustained in the future, and what sort of long-term impact there can be of the more positive or creative elements that came out of grassroots organizations or good initiatives, and how to sustain those. Thank you.
Who wants to answer?
Maybe I can start. I'm sure people can give different kinds of examples. We've been really inspired by the better stories of responding to inequalities in different grounds. In the case of gender-based violence, a lot of feminist and LGBTI organizations say that they have creatively used the digital space both to help people gain digital access literally, giving out, for instance, cell phones, iPads, and so on and so forth, and connecting through the digital space. So people who could not before join their meetings because they could not leave their homes, or they were far away from the centers, the main cultural, political centers of organizing, were able to join even from their, kitchens, and even when they had their children around or when they were cooking. So there seems to have been a much more widespread organizing made possible through the digital space, so a much wider networking and more intersectoral networking or interorganizational networking, both within countries and across countries. So more networking, for instance, around the Istanbul Convention and how to better respond, how to better develop a legal framework to respond to gender-based violence, again, with the use of the digital space, or having coming together to refer people who need services in different contexts. So creating a really wide net of both support, response, and advocacy, or creating solidarity, incredible examples of new forms of solidarity being organized during the pandemic, for instance. So we will be looking more into and making these cases available. Some of them are already available on the RESISTIRÉ website. So there are really an impressive list of inspiring stories, of better stories on the RESISTIRÉ website. And we see it as really significant to make them more visible and to learn from them.
Thank you.
Thank you.
Another colleague volunteering? Sophia?
No, I just wanted to say that this is also something that we, within the consortium, will be and probably are able to produce more results on and analysis on and publish on. But a lot of the other questions that we've been presenting today and the knowledge gaps that we've been presenting today, the whole research agenda, they are also things that we cannot do within the project alone, that we need to think of these presentations as recommendations. Dear Lord. To be taken up sort of beyond our project. So that's also a bit of a wink to you, Leanne. I think that we want the Commission to pick up on some of these questions and support more research in these areas.
We have another question on the concept of community health that was mentioned by Federica. Question 2, maybe explain it further, how to investigate community health and what is the added value that we consider this brings.
So maybe I can start, and if someone else from my colleague can also add something else. The concept of community health, as we intended and we would like to see it developed, is more to have the community as the center and not the individual, as of course the term said. But we mean, so we would like to see addressed the specific problems that a community might have, that might be in terms of geographical terms, basically can mean to focus on a specific area of within a country, within a region, with specific health issues, and meaning that the health problems are not only of one individual. And so then it might be that we see one individual having this issue, but it's not that we have to, we might develop, I mean, it's not only that individual having that specific health issues. So health issues might be from different individuals within the same groups. And so basically, in terms of our project, we can think about migrant women. And so the migrant women have the health problems of health and health-related issues of these groups are shared within this community. And so focusing on the idea of community means that we are not, we might address more we might reach more answers than just addressing one specific individual. So I don't know if that answers the question.
I'm sure it answers the question. Thank you, Federica. I see Rana raising your hand, maybe to continue the answer.
Yes, so just wanted to continue on what Federica has said. So in fact, what's happening most of the time is that in the context of care, a person is really removed from its context. And so recommendations are given without really accounting for the person's capacities, so in terms of literacy, but also in terms of possibilities and resources and ability to continue this process of recovery or not. So this is why it's very important to consider the context. And different approaches have been developed in the past in order to work on community health. And it depends on the context, it depends on the country. So the idea would be really to just work further in developing the idea of community health in order to be able to be more available in different countries, in different contexts. For migrants, for instance, what can we do in order to bring healthcare to the community, so that the community, so that we can take into account all the different limitations of this community. So this is really the idea of it, to consider the advantages and disadvantages of different communities. Yeah.
Thank you. No more questions. One of the elements that I think has been clear is the overarching importance of digitalization in the different domains that we covered, and which triggers research questions and also triggers opportunities, like Aisha has been mentioning. And it's one of the overarching messages of the different agendas. But Aisha, you wanted to add an element?
Yes, I just want to add a concept that has been circulating a lot in our research, which is the concept of holistic health, which connects with the community health question. Holistic health includes the community, includes well-being, mental health, includes the context in which we live. For instance, green spaces, the availability of public green spaces has become really significant during the pandemic, and we have a specific pilot action developed in relation to green spaces. So how can we rethink health from a holistic perspective? A concept of health that includes all aspects of life, I think, is a question that comes out of our research, and that would be great to develop and operationalize in the coming years with further research.
Thank you. I propose to thank you all to be participating in this webinar. Even if we close a few minutes before, there is no need to fill completely the time. For us, it was very important to attract your attention to the project and its results. And I want to remind you that we work in cycles. So we have now produced, after the first cycle, a first set of research agendas, which we split into 4 subjects. We will do that again. So we are in the middle of the second research cycle, and after this summer, we will again organize webinar, and then again early next year, we will organize webinar to promote the research agenda. But we do that also for other results. So that is the case for the recommendations. So we have recommendations for policymakers, for municipalities, for civil society, for employers. And we do that like we do it today for the research agenda. We produce fact sheets and recommendations for these different target groups. So please spread the message. Today, we notice that we have a lot of researchers here. That's very good to have researchers, but also funding organizations and funders of research are our prime target with the research agendas. So the research agendas are there for you. If you would like different information that we provide, because we formulated that research questions with some facts and figures behind, explaining how we come to the research questions. But if you need additional information or want to integrate some of these research questions into calls that you plan to organize, do not hesitate to contact us, because our purpose is, of course, that the results of our research work is being used. And so we are learning by doing. I think it's exceptional for researchers to try to attract the attention of the funders, to spread the results of the research and influence the research questions and the topics you will use in the launch of future calls. But that's exactly what we want to do. So if you can spread the message to your colleagues, to other research funding organizations, please do, and inform them that the information that we share today is available, and we are there to answer whatever questions that you might have. So thank you to spread the message, and I thank you for listening to us and participating in this webinar. Hoping to see you in the future. Thank you all.
Thank you.
Thank
Bye-bye.
you. Bye.